I'm so excited for this conversation with the Libido Doc. Well, my Libido Doc is her website. We have here today Dr. Diane Mueller, an ND and DAOM, which means she's a sexual wellness expert with dual doctorates in naturopathic medicine, acupuncture, and oriental medicine, which I just think is such a wealth of expertise that complements what's available. And of course, for many people, nothing is available or they're unfamiliar entirely with libido. But I just think that the background you have is such a compliment to any kind of allopathic or sexological body work or any of those things, which I know you do as well. I just want to tell you that I'm really excited that you're here and look forward to having an amazing conversation about libido. Is there anything else that you want included before we begin?
I think the biggest thing is really helping people understand that low libido is not just about intimacy and sex and pleasure and all those things. It is, of course, but I really look at low libido as just a symptom of some imbalance in the body and oftentimes the self and the relationship. So I think in medicine, we have all of these symptoms which are just flags. And I think so many times people get into these situations where it's like, well, I'm just gonna not worry about low libido and not worry about my sex. I'll just put that in the corner as like, I don't do that anymore. And I would feel the same way, like the same level of concern if somebody came to me medically speaking and was like, well, I've have fibromyalgia for 20 years and I'm just not gonna do anything about that because I just decided I just have to live with it. It's like the body is talking. So that's like one of the most major messages I hope I get across to people is that this is a symptom. It's your body, it's your relationship, it's your life talking to you. And it's really important beyond the sex and beyond the passion. All those things are super important, but it's really important, I think, to also look at this as a true symptom that is just telling us that something is out of balance.
I really agree with your approach. And I think anyone who's listening to me is convinced that libido matters. I think you really described the misunderstanding that it's just about sex. And yes, it's an imbalance in the body. Do you have a definition that you work with beyond that, or is that basically it?
It is an imbalance of the body, the individual, and the relationship. And oftentimes a combination of those three. I think it's really difficult, right, to come up with an exact definition of low libido. It's like in medicine, we talk about hypoactive sexual desire disorder, but how to even diagnose that is so subjective. It's like somebody has to come in and say, well, they have low desire that goes on for 6 months or longer. Well, low desire as compared to what? We don't really have a normal established. So I look to things such as like surveys that show that couples are the happiest when they have been intimate at least about 50 times a year, averaging just under that once a week mark. So that's something I tell people to look out for around like, hey, in health, we know all of the advantages of having sex or being intimate or creating orgasms or closeness or oxytocin or all these things. And we see surveys that are showing, hey, 50 times a year is where couples are reporting to be the happiest. So that's just kind of a baseline. Like I think a lot of couples do well having sex or being intimate even more than that. So it's not like a perfect thing, but if it's less than that 50 times a year, then there probably are some level of detriments that I believe could be happening to the individual or to the relationship. So that's how just kind of a starting baseline that I tell people to consider. But, I do think this is pretty nuanced.
I like how systematically you think. So let's go through for a couple where there's mismatched libido, and let's go with the circumstance. It's definitely not always this way, but the circumstance where the low libido is in the woman and the man has high desire. Physical, emotional, and relational are the three categories, right? How can someone listening think about the physical considerations when it comes to low libido?
I love this question so much. Thank you for orienting it to a real life situation of the desire mismatch, because I think it's such a common and great way of orienting to this information. Anytime there's, in this example, desire mismatch, and in your example that, okay, for this particular couple, it's the woman that's experiencing the low desire. From the physical side, we want to consider the obvious that I'm sure people have thought about before, hormonal picture. So that's our estrogen, progesterone, testosterone. We want to figure out and look at the circulation, right? So that's probably come up on this show before around like, are we getting proper blood flow? And just to remind listeners or tell listeners that have not heard this before, it's like we emphasize low blood flow to the genitals so frequently for men when we think of the need for engorgement for erectile dysfunction, but we need this for vaginal lubrication. We need this for sex to feel good. We need this as women for our tissues to be engorged as well as men. Making sure that we're not ignoring that circulation as part of the female picture of low libido. And then, of course, we have neurological root causes. One of the things that's interesting about the neurological root causes is there's going to be anything that then is going to, say, inflame the nerves or lead to a neurological dysfunction of signaling. So the brain is not sending the right signals to the erogenous tissues to get engorged, to get turned on, to get lubricated. This is talked about oftentimes in things such as like trauma, right? Where somebody actually has something like spinal cord injury and we get some of that neuronal change. But another thing that people don't often realize is there's a lot of things also that can lead to the nerve conduction going down to the genitals. For example, chronic hidden like toxins. Like I see this with things like mold toxins. I see this with plastics and pesticides. But also interestingly enough, we see this even with situations like blood sugar disorders. So if somebody has a continued insulin resistance or pre-diabetic or diabetic situation, or even just random blood sugar swings, right? Where we can get that extra sugar in the blood that's not getting inside the cells. Well, we know in medicine that this can lead to things that we call things like peripheral neuropathies, where we actually see the nerves in the endings where the nerves go to, or sometimes even numbness. What we forget about is that the nerves to the genitals can also be affected in the same sort of way. So we can even see blood sugar abnormalities leading to things like these neuropathies in the genitals where sex feels not so good. All of those kind of things go under the nerve, say, category and part of the physical root cause that people forget about. And then, of course, we have stress. And so that one, I imagine, has been talked about. We have anything that is going to, say, raise cortisol and lead to that sympathetic, that fight or flight dominance, like that's getting people out of the ability to sink deeply into pleasure, into the moment. And we see that when people have a high amount of stress hormones, it's very common for the thyroid to not work. And that can lead to problems in the bedroom with libido as well. So that all kind of goes under that stress category. We have the circulation, we have the neurological, we have the hormones, we have the stress, thyroid there. So that's 4. And then the 5th one is the pelvic floor health. So this is where, especially with time, but also due to traumas, due to childbirth, due to just misalignments in the spine, we can have situations where the pelvic floor is not working correctly, where these muscles are not stretching appropriately, not relaxing appropriately, where they lose their ability to function like healthy muscles and ligaments. And that can lead to a lot of pain or dysfunction or other types of abnormalities in the vagina, in the cervix, and the clitoris, and the whole sacral region there. And that can really lead to some pain in the disinterest in sex, because why are we going to do this, of course, if it doesn't feel good? So those are the main. And then, in medicine, I feel like we can always come up with like, there's always like those other things, right? It's not saying that these are the only physical root causes, but I do find in like helping people think about this, it's really helpful to go through these. And then also, just for your listeners, I do have a quiz that goes through these, a free quiz. So that's at libidoquiz.com. And that's just a quiz I developed with the help of a developer. So it's a very detailed based quiz where you put in answers and it's going to spit out like, for your symptoms, you might want to talk to your doctor. Make sure you talk to your doctor about things like circulation or pelvic health. And then it follows up with an email of like questions you should ask your doctor about and tests you should ask your doctor about, and those kind of things as well.
Especially with what you're saying about the answers or results for the quiz, it sounds like the main thing when there's a physical root cause is to see a doctor.
Yeah, I mean, it's one of those things, like I do think there's benefits, right? With like circulation, we know that citrulline is an amazing vasodilator. Arginine as well. A lot of people have heard of arginine, but arginine's not super well absorbed in the gastrointestinal tract. So arginine will dilate your blood vessels, get more blood to all over your body, but the genitals being part of it, but it's not super well absorbed. So we see that a precursor to arginine, citrulline. So citrulline turns into arginine in the body. Arginine dilates our blood vessels. And if we start with the citrulline kind of further back, it is better absorbed. So people can try those things. And I think it's a very reasonable thing to try. I do think we should always keep doctors informed about, what we're doing for just important health reasons. But I get worried when people are just like not also keeping their doctor informed about this, because like cardiovascular disease, we know is the number one killer of people worldwide. And oftentimes things like low libido is the first early warning sign. So it's not saying don't also do those things, but it's saying like, hey, let's be smart with these messages the body is sending us. Maybe it is a super minor thing. Oftentimes it is, but if it's not, the idea of like catching something when it's a small minor thing versus a big thing, I think it's just really medically smart. And it just helps people tweak those things when hopefully they're small before they do become more major issues.
Okay, excellent. That's so good. Let's move on to personal causes.
Yeah, I love this section. I think it's really important to talk about this because oftentimes low libido, like it's really common, right? I think where people come in, and I don't know if you have people you see like this, I imagine you have, where it's like, oh, okay, we get so excited about the testosterone and get somebody on testosterone that needs it. And there's this all of a sudden, oftentimes where people, this boost, right? I've seen it so common where either it's not totally fixing or there's like, they come in and it's like, wow, testosterone really like helped my libido and everything's turned on. And I'm like, really loving this. And then 3-4 weeks later, all of a sudden it's not working as well anymore. And it doesn't mean that testosterone is not beneficial and not part of the package. It's like, I think oftentimes it's a huge part of the package, but being in medicine for 15 years now, I've never seen these situations that are like chronic situations that really have just one cause. It's usually a combination of things. So the personal is related in some ways to what I talk about around having the right kind of sex. I think so many couples get into this thing. They are not having the right kind of sex, and that actually starts with the individual. If we take a step back and go back to where most of us learn about sex, I learned about sex in Red Book. I was little and I was super nosy and I was snooping through my mom's room, and in her closet behind her file cabinet, I had found all these books of Red Book, which is kind of like the Cosmo of the 80s, I guess is maybe how I would describe it if anybody doesn't know that magazine. And so, it was like talking about sex and talking about blowjobs and talking about essentially how we do these acts, but in a very mechanistic medical perspective, right? So that's how I learned about it. I know a lot of people will learn about sex through just somebody at school, and then we kind of learn about it through the media and through porn if we're watching that, or that flash in the movies. So I think a lot of people, and women in particular, go through life having sex or being intimate in a wide variety of ways, thinking that we need to do it as women, like our bodies are set up like men. And even in school, it's like the way we learned about the arousal cycle was very just masculine. It was the masculine arousal cycle of this increase and this growth, right, in the feelings and the arousal to that peak of the climax, that kind of that crescendo, climax decrescendo type of curve. And that's just not how the female arousal system works. So part of having the right kind of sex for women starts within the personal. And that really begins with learning our own body. And I think, so many women, like, we don't even realize that the clitoris is way more than just that little head. We don't realize all of the erogenous zones that we have in our entire vulva, that, the labia are really, really full of nerve endings. Just because the G spot works for her, the G zone, as we're now calling it, works for some women, that other women have a lot of scar tissue there. And other women have so many nerve endings that it might not even feel as pleasurable, that we're all so wired differently. So that personal really comes into allowing ourselves to start to explore our own bodies, to say, forget the social media, forget the porn, forget the movies that look like women have penetrative sex in 3 minutes and are having the best time of their life, which is total bull. Doesn't not how it works. Forget all that, right? And just help us move into learning our own bodies so that we can begin to start, when we get into that relationship or we continue into our relationship, start actually asking for what we want. Because I think that's the biggest thing. It's so hard to know what we want if we haven't explored our own bodies.
Okay, well, I think it's beautiful what you've shared. I really appreciate that you call this category the personal, which is very different from the emotional. I mean, it includes it, but it's definitely not the only part. So I guess the only question I have about that before we move on to the relational is, I think for people who've already taken, let's say, the first 5 steps on this beautiful journey to reclaim sexuality, pleasure, pleasure, sovereignty in the erotic realms. If you've taken 5 steps along already, then what you've just said is just so clear and compelling. But for someone who has been like feeling like they have low libido, getting that feedback from their spouse, either overtly or not overtly, but it's been a thing, let's say 5 years, 6, 7, whatever it's been, could be longer, of course, could be shorter. But the point is, she's entrenched in thinking of herself as a woman with low libido. Too bad. She would have liked to have more libido. She's taking her regular, menopausal, perimenopausal, HRT hormones. It's not really making a difference. So she's just kind of stuck there. And now hearing there's this whole journey to take. Where might she begin? I feel like in the old days, we used to say, get out a mirror and become familiar with your anatomy. But where would you say the very first finite step should be?
I think one of the first things is starting to prove or disprove what we want in our lives. Meaning, it's so often that we get these periods that we're talking about. This is just me. This is just how it is. And I think the first step with that is really, journaling and asking, personal questions. Is that really what I want? Would I like a more pleasure-filled life? Do I understand the benefits of oxytocin? Would I like to connect more passionately and intimately with myself and my partner? I think for, most people, these answers will be yes. I don't think it's going to be for everybody. Some people, I think when they're asking these kind of questions, you feel like, okay, you really are happy with your relationship. You feel like you are roommates and best friends, and you feel like you're getting your oxytocin dosage through hugs and these other things, then that's beautiful. I don't think there's like a total right way for everybody, but from a first step, it's, I think, really being honest. Because I think so many times when we get to these points in our life and we say, oh gosh, this is not for me, it's oftentimes because we're trying to do our best to compensate and accept what is. And it's like, if we don't know another way. And so I think it's, starting with being honest with ourselves around like, are we truly being honest with ourselves when we say it's not for me or it's not worth the trouble? Are we just saying that we're just accepting what is? And upon hearing podcasts like, like yours, I'm actually would like a more passion filled life, but I don't know how to get there. It seems like a lot of work. And then I think one of the things we need to do is start changing our beliefs around what is possible, because so many times I think we begin to say, okay, well, this is not for me, or I don't know, my body can't actually do that. These sorts of things. And that's not actually the core truth. I think we get these beliefs and we get stuck on them. So one of the first things we can do is start to kind of unwind those beliefs and say, is it actually really true that I don't want a low libido? Is it actually really true that this is not possible? Just because it's never been possible for me in the past, it's not been possible for me in the past year, or it's been difficult for me in the past year to get aroused, is it ultimately true this is how it's always going to be? And of course, we don't know the future. And then I think once we can begin to unwind that, we can start asking different questions like, what would it actually be like to have pleasure and passion in my life? What would it be like to connect more deeply? How could this change? And when we start to ask ourselves those different questions, oftentimes we get different answers. And I say this because when we're in this conversation around like, oh my gosh, how do I even begin? I think one of the first steps is getting behind the process of learning this, right? Getting behind the process of the why and finding that motivation. And we can change that belief and we can change that why. Then all of a sudden we can start then exploring with ourselves or with our partner. From your question, that's where I would encourage people to start and to begin, is changing the questions we're asking ourselves to see what's actually really behind and what's really true for us.
Okay, wonderful. Would you share your approach to relational?
I think the relational problem comes from something that a lot of us in the sexology world talk about, which is the sexual scripts that we get on. I was listening to many years ago, the founder of NLP talking about how when he got married, people were saying to him like, well, you better enjoy the sex now because when you get married, it's going to go away, right? It's going to turn bad or you're not going to have much to it. He basically was talking about how he would respond to these people and say, well, how is this that I'm going to do something over and over again and get worse at it. I was like, it really hit me. I was like, this is so true. So I use him as an example in my teachings a lot because I think it's so true. It's like what happens is that dopamine goes away, the new relationship energy chemicals go away, and we get stuck in our sexual scripts, which is where it's like, okay, we do basically the same thing over and over again. I kiss you this way, you kiss me that way, I do this act, you do that act, oftentimes leading in the big finale of intercourse. One of the things that I think is important in a relational is taking what we learn from the personal around our own desires, around our own body, our own anatomy, our own preferences, and beginning to develop ways of bringing that into the relationship. And there's two high level things that are important to mention here. One, how we communicate about this. And then two, how we bring novelty back in long-term monogamous relationships. The communication, I find that the easiest way of teaching about this is the how, the when, and the where. To break this down, it's like in ways we're thinking about, okay, well, I want to tell my partner that this is just a little too hard and a little too fast, right? And we want to say something like that. And we're like, okay, but we have to be concerned about this because we see in studies around conflict show us that anytime there's a discussion interrelationally, there's three different threats. There's the threat to the self, the threat to the other person, and then the third is the threat to the relationship. And that's just like normal kind of like intense, those kind of conversations that feel more intense, right? But in sex and communicating about sex, out of those three arenas, the one that is the biggest threat we see in studies is the threat to self. And this is why when we bring up sex, it's so easy for the ego to be like, oh my gosh, it's like a threat to me. I'm not doing it wrong. I'm not providing all these things, is because that's the biggest threat. So this is where the how, the when, and the where come into so important. So the where is thinking about, okay, well, especially if we're new to these types of conversations, initially it's probably best not to have them in the bedroom or the main areas where you are having sex. And that's just because if it doesn't go well and you make mistakes initially, you don't want that association with the bed or wherever you're intimate with that memory, right? So it helps to dissociate those types of things. The when is oftentimes also in the beginning. One, not having these conversations immediately after sex, because again, you've just finished that. Once you get more skilled at this, sometimes I find it's a great time to have those conversations. But in the beginning, oftentimes when you're developing those skills, that's not the best. It's also, I find, really helpful from a when perspective to ask permission to, say to your partner, like, hey, I listened to this podcast. It like inspired me I want to talk about our sex life more. So, is there a time that like, do you feel up for this conversation now? Do you feel up for this conversation later? We want to be careful here because sometimes we can say, okay, well, when, and it's like never a good time and never a good time and never a good time. And then it never gets talked about. So there's not necessarily going to be that 100% perfect time. We do want to watch out for that. But we oftentimes don't want to have this conversation maybe when our partner's like gotten yelled at by their boss or the kids have been screaming all day and somebody is just completely overwhelmed and stressed out. And when we give that warning around like, it's not the honey, we need to talk warning, right? So the frame is like, listen to this thing, like, let's talk about this. This could be fun. I want to explore this with you. Is a very different frame than honey, I want to talk. And then the how is thinking about, okay, how are we framing this, right? So going into a conversation, especially when we're new at this, and immediately being like, I need you to slow down. This is too fast. Likely not going to go the best, right? So it's very different than if I figure out what I love and what I want more of and focus on that and then talk about what that does. So if there was a moment, and like, it's helpful to note this if you guys are sexually active. Sometimes if you're not, we just need to start these conversations. But if you are sexually active right now with a partner, it's helpful to notice like, oh yeah, like when we did this in this example, he got really slow and I loved it. And then going into the conversation around like, hey, I just want to tell you that when you went slow right in that moment, that was just like the most amazing thing for me. I just absolutely love that. And I would really love more of that. And so then oftentimes when we do some of those, then we can get into the nuances once there's been safety of like, this other thing that we did, my body's just not responding to it as much anymore, right? So there's like those level of details we can break down in more detail, but from a standpoint of higher arcing things, we can focus hugely on what we want more of is the primary thing, and then make what we want less of is like, let's talk about it, but let's not go into those details, at least not in the beginning. Like I said, in time, we develop the skills to do that, can be more successful. So I can talk about the novelty and monogamy thing, but I know I just said another mouthful, so I want to pause again for you. So the novelty and monogamy is, I like to talk to people, the way I frame this for people of bringing like that newness back in, right? How do we keep this newness here? How do we say that after being together for years and after doing the same sexual script, how do we actually get to a place where we're still bringing back some of that new relationship energy? I tell people in like exploring what you are interested in, ways to think about this is people, places, and things. These are kind of categories that we can consider for bringing that novelty in. How do we bring people into a monogamous relationship, right? So you're listening to this. It's a fun exercise to go through and be like, yeah, I could explore that more. There's something here as you're categorizing these this way for people, not because these are the only things, but because they're ways of opening up the door to the creativeness to say, what else could I bring into the relationship? So this is where we can get into things like role playing, fantasy, things, even simple things like wearing wigs or trying on different personas. There's really fun like archetypes out there for anybody that studied things like S Factor. You can look up S Factor archetypes and they'll talk about the different archetypes that women have inside of them. So these different like parts of ourselves, and we have these predominant parts of ourselves that get to play out in sex, right? That we're just like our go-to person. Like one archetype of this model is the playful teaser, that innocent person inside of ourselves, right? That total high school flirt. Another way to bring in more novelty, an example with things to consider like role play, is to actually embody a different part of yourself, to allow this part of yourself that maybe doesn't play in the bedroom. Because the bedroom is our place that we can play, right? It's our place where we can create. And so we show up and we're like, oh, I'm going to let this other part of myself come to the table more sexually. We can actually create a very different sexual experience for our relationship. And it's like so fun when I do this with my partner because he will notice, right? Just like allowing this other part of myself, still me, but just a different part of myself to express through. So that's people. And then places are, very obvious. It's like, okay, as simple as, hey, maybe it's like in the closet of your walk-in closet instead of on the bed, right? I've known couples to do that. Can you go rent rooms by the hour and go like get a fun hotel rooms? And those rent rooms by the hour, very nice hotels do that because they do it for business meetings all the time. So it doesn't have to be a sleazy place, right? So we can think of like places around our house, places around the community, renting rooms by an hour and having a hot sex date. All of these different ways are creating novelty by using places. And then things can be anything such as bringing sex toys in, such as bringing things that are more, say, kinky or new around like blindfolds and handcuffs and all these sorts of things. So it's bringing in toys or other objects into the relationship. Again, there's a lot of different things we can do with beyond that, but starting and going through these types of topics, I find help people from that creativeness of, okay, how can I bring more of this into my relationship?
I love that you added that because yes, if you want more spice, you're going to focus on people first, places first, things. And of course you can do an intricate blend, but also just start with one variable and change it. If people want to learn more, what's the best way to follow up with you, Diane?
I would say definitely go take my quiz at libidoquiz.com. That's a really easy, free jumping off point. You also can join. I have my Libido Club. So my Libido Club is just a membership, just kind of like a gym membership. And I update new content there every month. And it's anything from learning techniques to going more into the communication, to learning more about your own body, to how to bring vibrators into your sex play for the first time, how to have better orgasms, how to edge as a man and sustain longer orgasms, and so much more. So if you want more information, you can just go go to mylibidodoc.com, my website, and learn about my club and so many other things.
Okay, wonderful. And it sounds like the Libido Club is for both men and women.
It is. Yep.
I really love that you've created that space, because so often you have to look for it, but there's a lot available for women navigating low libido, but for men who either are navigating low libido or have partners who are, I love that that is part of what you offer. I'm really happy to know that. Well, thank you very much this felt like a TED Talk of sorts. It was so rich and informative. I really appreciate it so very much.